الأستاذ المساعد الدكتور هادي صالح من كلية الصيدلة جامعة بابل، فرع العلوم المختبرية السريرية. محاضرتنا اليوم لطلبة المرحلة الثانية بمادة البكتيريولوجي بعنوان Mycobacterium Tuberculosis. Mycobacterium Tuberculosis is one of the bacteria that causes important disease to the human. It's an obligate aerobic bacteria growing most successfully in tissue with high oxygen content such as lungs. For this reason, it's causal agent of tuberculosis, which is a disease that affects respiratory tract. These bacteria, it's intracellular parasite, usually found in macrophage. It has slow generation time, range from 12 to 18 hours, in comparison with other bacteria like E. coli, which has a generation time range from 20 to 30 minutes. These bacteria, neither gram-positive or gram-negative. It's stained with a specific stain called fast staining, and this bacteria known as fast bacilli because of their lipid-rich cell wall, which is impermeable to various basic dye unless these dye are combined with phenol. Once stained, this cell resists to decolorization with acidified organic solvent and therefore called fast bacteria. Up to a third of the world population and about 15 million Americans carry Mycobacterium tuberculosis and carrier for this bacteria without showing any clinical symptom. And only about 5 of these infected people actually develop clinical tuberculosis. It's usually transmitted through droplets of mucus, respiratory mucus that suspend in the air. This figure shows the shape of bacteria under microscope. Usually it's stained with zeolnersen stain. It's bacilli, the ground which stained with methylene blue stain. Pathogenesis. Pathogenesis for this bacteria, which can be classified into primary TB and secondary TB. In the first one, primary TB, Mycobacterium tuberculosis, which is produced no toxin or enzyme that contributed to its virulence. Bacterium inhaled into the lung and arrived to the alveoli and phagocytosis by alveolar macrophage. Then replicate intracellular and cell macrophage. At this time, individuals are unable to mount a rapid response that destroy phagocytosis cells that engulfed them. At this time, also other phagocytoses are attracted, and repetition of this process, phagocytosis of bacilli and replication and cold and lysis of macrophage lead to the formation of multi-nucleated big giant cell, and after 3 to 4 weeks, immune cell and bacteria form masses. This known of a granuloma or a tubercle. After that, cytokine production by CD4 T lymphocyte activated macrophage, and then these bacteria are able to kill bacteria that localized inside macrophage. When formation of a granuloma can lead to elimination and bacteria and heal of the patient. And the effect immune cell then form around cell wall around inactive bacteria and gradually collected calcium and calcify them to form what is known of gone focus. The tubercles often heal and leaving permanent scar that appear as a shadow in chest X-ray. At this stage, this disease not progress and the bacteria remain in the body for many years. and the patient don't have any clinical symptom. The second type, secondary TB or reactivation TB. This type of TB occur usually if immune system become weak, and suppression of the immune system when take the individual immunosuppressive drugs, or at old age, or if you have cancer or HIV infection, can lead to reactivation. The bacteria that found in tubercle, and break of this lesion, and multiplication and releasing of this bacteria, and this infection may be developed into secondary TB. Usually secondary TB has more severe symptoms, and usually distributed among leg, and any treated secondary TB cases have 16 mortality rate. Also, maybe TB distributed to other site outside leg, and causes extrapulmonary or systematic TB. During this, bacteria disseminated to the lymph node, bones, brain, and kidney. This figure shows the radiological difference between primary and post-primary or secondary tuberculosis. In the first one, we show that the tuberculi that found in one site and a lower lobe in the leg. While in secondary TB, we show that we found that granuloma and lesion distributed among the leg. Clinical manifestation. Tuberculosis primarily affects the lower respiratory system and characterized by fever, chronic productive cough, often with blood, night sweat, weight losses, malaise, losses of energy, and loss of appetite. This figure shows the bone focus that affected the leg of infected patient. Epidemiology. Mycobacterium tuberculosis, usually these bacteria affect about 5 to 10% of the infected normal individual. He developed active disease. It's most common disease among poor, old patient, immunocompromised patient, such as patient with HIV disease. Diagnosis. Diagnosis of this bacteria usually depended on a clinical manifestation that detected by the doctors, and also chest examination. Second, also can be diagnosed when the patient come to the laboratory, and the laboratory make a fast staining of the sputum taken from the infected patient for direct identification of bacteria, and staining with Ziehl-Neursen stain. 3. Culture to isolate of the bacteria, and then done biochemical testing. 4. Mantoc test, which is in vivo or tuberculin skin testing. In this test, mycobacterial antigen used in the skin test come from a purified protein derivative of the cell wall at 5 tuberculin units, then injected to the intradermal layer. Positive test when red area and induration, which is developed at 48 to 27 hours due to cell-mediated hypersensitivity reaction type 4. Occur if the T cell have been recognized the derivative protein, and a tuberculin test become positive within 4 to 6 weeks after infection. Positive reaction means that the patient has exposed to the organism, but it also can mean that the patient maybe have active infection, or may be infected and asymptomatic, or be maybe the patient had been immunized. I mean that the patient exposed to the bacteria. This figure shows the tuberculosis case, which is when injected with PPD at intradermal layer, and after 48 hours show in duration and rate area. This figure showed the bacteria when grow on culture media, on Langstain Jensen media, which is a specific media to this bacteria. Treatment for this bacteria is unique treatment because this bacteria, which is unique bacteria. This bacteria usually slow growing cell, hard to treat it. I mean it's resistant. Therefore, a long-lasting therapy may be taken over long period of time with multiple antibiotic therapy, which is take from 6 to 9 months. The duration of the therapy. Multi-drug therapy usually is used to prevent emergency of drug-resistant mutant that may be occur during the long duration of treatment. Organism that become resistant to one drug, which is maybe inhibited by another drug. Therefore, we use the multi-drug therapy. The therapy usually consists of 6 to 8 months course of isoniazid, pyrazinamide, and rifampin. Usually, isoniazid and rifampin given for 6 months, but pyrazinamide is stopped after 2 months. In patients who are immunocompromised, like each patient have cancer, old patient, maybe use another drug, fourth drug, such as ethambutol is added, and all for a drug given for 9 to 12 months. Although therapy is given for a month, but the patient sputum become non-infectious within 2 to 3 weeks. The necessary for this therapy, maybe it is attributed to the intracellular location of the organism, gaseous material, which is block penetration by the drug, and metabolic inactive persistent within the lesion. Currently, about 10% of the isolate are drug resistant. Development of multi-drug resistant tuberculosis as defined as the presence of Mycobacterium tuberculosis resistant to at least isoniazid and rifampin. The treatment of this bacteria usually maybe involve use of 4 to 5 drugs, including ciprofloxacin, amikacin, ethanamide, and cycloserine. Prevention and control. Number 1, use of the UV lamp in the air fellow system and negative pressure room for TB patients. Also improve the social conditions such as housing and nutrition. And important thing to in vaccination of the individual with BCG vaccine in country with high rate of the TB. BCG vaccine usually uses live attenuated Mycobacterium bovis that causes TB in the cows and causes cross reacting with Mycobacterium tuberculosis. Used to stimulate the serum-mediated immune response, as Mycobacterium tuberculosis is largely intracellular pathology. 3, most effective in children, which is given as part of early childhood treatment in endemic region. And thank you for listening to me.